It's been a tragic time
that has shown a bright light
on our halting national response to a global crisis,
and on deep health disparities we've failed to address for decades.
But if this light has illuminated challenges we must face, it has also shown us strengths we can build upon.
From research that created vaccines to save millions, to the power of community action to narrow gaps in health outcomes.
Now that Americans can see clearly that public health success or failure is a matter of life or death,
can we leverage our time in the spotlight to empower our mission?
Public health visible.
Welcome to the 2021 Bloomberg American Health Summit.
In this moment of visibility, we'll consider 4 key issues this morning.
As our nation recovers from the worst of the pandemic, it's clear that many communities were hit harder and will take longer to recover. We'll explore the warping effects of structural racism and the social and economic inequities that lead to poorer health outcomes for far too many Americans. We'll also learn from successful efforts to think about an agenda for the future.
The past 2 years have not only brought us a global pandemic, we've seen rising overdose deaths and homicide rates with shocking declines and disparities in life expectancy. At this unprecedented moment, misinformation and threats have undermined public health like never before. We will be hearing from public health officials about working through this tumultuous time and what's next.
The COVID-19 pandemic will cast a long shadow, but it won't be the last epidemic we face. Looking toward the future, what can policymakers and public health officials do now to tackle urgent challenges and prepare for future public health emergencies at the same time?
We all recognize the Johns Hopkins map, which symbolized the most extensive use of public health data in our nation's history. How can we learn the data lessons of the pandemic to address other critical health challenges: addiction and overdose, adolescent health, the environment, obesity in the food system, and violence?
We know that public health has a rare moment of heightened visibility on the national stage.
And the Bloomberg American Health Initiative is seizing this moment by pushing forward on all our key efforts. Since its inception, the initiative has graduated 43 Bloomberg Fellows
and named 211 fellows from 40 states, Washington, D.C., and 1 territory.
And collaborated with several hundred organizations.
Funded more than 200 projects and named 20 Bloomberg professors and centennial professors of American health.
It's all of us together who keep public health visible.
Good morning, and welcome to the 4th Bloomberg American Health Summit. I'm Michelle Spencer.
And I'm Josh Sharfstein. It's great to be back in person this year.
Josh?
Looking out on this packed room of amazing students, partners, faculty, and public health leaders,
Josh?
Yes?
Are you sure you have the right remarks?
Maybe not. This might be the version I wrote back in June.
You think?
Okay, here we go. I can't believe we're doing this online 2 years running.
I can believe it, and it's going to be amazing.
This is an incredible moment for everyone fighting for a healthier nation and world. We might have been in person before, but our issues were often on the back pages, if in the newspaper at all.
Now, public health is all over the front pages. COVID, overdose, violence, food. It's impossible to ignore.
Exactly. Public health visible. That's our theme this year.
So there's this question on the internet. Which superpower would you rather have, flying or invisibility?
For many years, those of us in public and community health have chosen invisibility. We've remained out of sight, working to keep people healthy.
Good luck trying to be invisible today.
Public health is now impossible to ignore. Our challenges are the nation's challenges. Our work is in the spotlight, even if that spotlight can be harsh. We can't hide, so public health has only one choice.
We have to fly.
That starts with telling the story of how public health advances equity and saves lives, with evidence, with community engagement, and with policy.
That's why we're here. Today, you'll hear from people who are leading their communities through COVID, who are charting a new course on overdose, and who are helping us rethink how to prevent violence.
We'll learn about elevating the day-to-day work of public health in the national discussion about preparing for the next pandemic. We'll discuss the lessons of data use during COVID for other pressing public health challenges. We'll be inspired to confront racism and much more. There might also be some surprises.
Thank you for joining us.
We'll start with a video on the overdose crisis, which has claimed the lives of a record number of our family members, friends, and neighbors during the pandemic.
And now, let's hear from Mayor Mike Bloomberg, whose vision and support for a healthier and more equitable nation has made the Bloomberg American Health Initiative possible.
He always has something interesting to say at the Bloomberg American Health Summit. I'm looking forward to this.
You would think as a child who grew up with, a mom who ultimately died from an opioid-related overdose death, that I would have been like, that's a bad idea, is obviously no good, right? And it can kill you. I think at the age of 13, when I started using alcohol, part of what was behind that was that I really couldn't understand what it was that would make a mom choose this stuff over being a mom.
Our overdose crisis is really a profound public health one. There were over 70,000 drug overdose deaths in 2019, tens of thousands more than the number of car crashes and the number of gun violence deaths that occurred in 2019. Certainly COVID is something that we are grappling with as a city. It has exacerbated some of the risk factors for overdose, such as isolation. In 2020, it was a 30% increase in the number of drug overdose deaths that we have seen as a country, which was the highest on record.
Right where I'm sitting, 3 people by the end of the day will have died from an opioid-related overdose death.
Individuals are dying in every demographic group in Philadelphia, but a lot of them are happening in sort of young people, and that premature loss of life there is really sad.
I started with alcohol and then progressed to like marijuana and different pills, and it just continued to progress. It was not long before I wound up in my first of what would be many institutions as an adolescent. And then when I would turn the TV on, it was commercials about this is your brain on drugs.
This is your brain on drugs. Any questions?
I really grew up in this world that taught me that people who use drugs are bad people.
There is this misperception that a certain program or a certain policy will be enabling. I think stigma limits us severely in some cases of where these sorts of services can go.
Harm reduction is a social justice movement, and it really is built on the idea that people who use drugs deserve to do so as safely as possible and without punishment or being targeted because of their drug use. I was just talking to a young man who came here to buy drugs, parked and used them. He said that he wants to go into treatment, but not today. And so it was like, okay, what could you use today? And what he needed was some water, some Narcan, my phone number, and where to get sterile syringes. That's harm reduction in action.
Harm reduction programs can range from syringe service programs to naloxone distribution to fentanyl test strips are some of the ones that our department have sort of been really working on.
Harm reduction strategies are saving lives every single day. If we didn't have the money coming in, then I am certain we would see even more death.
I'm very grateful for the support of Bloomberg Philanthropies and Vital Strategies for their commitment here in Pennsylvania. And so my hope is, as I sort of look ahead to the next several years, is that we do appreciate, as a country, the public health crisis that we are facing, We really need to approach this from a fundamentally different way than the country has historically approached drug use, and that we really begin to invest more resources.
Somebody does not need to die because they are making choices that someone else disagrees with.
Hello, everyone. Welcome to the 4th Annual Bloomberg American Health Summit. Our mission at Bloomberg Philanthropies is to ensure better, longer lives for the greatest number of people. And through our public health work, we're doing just that. But we all need to do more. We announced the launch of the Bloomberg American Health Initiative back in 2016 because in the United States, life expectancy had decreased by more than 2 months from the previous year, the first decline in almost a century, which is unacceptable for a nation as great as ours. And due to COVID-19, life expectancy has gone down again by approximately 1.5 years. But much of what caused the initial decline existed before the pandemic. And unless we confront those things head on, they will continue to exist long after the pandemic ends. This summit is a chance for us to come together, to learn from each other, and identify solutions that will save lives. And I just wanted to briefly mention one way we're doing that at our foundation. A few years ago, we looked at the data behind that first downward trend in life expectancy. It was clear that a major cause was one of the worst public health crises we've ever faced, the opioid epidemic. About 130 Americans die from an opioid overdose every single day. Since the epidemic began over 20 years ago, more than 750,000 Americans have died. In 2020 alone, an estimated 93,000 people died from overdoses, the largest number ever recorded in U.S. history. These numbers are staggering, and the human toll is truly tragic. The victims left behind millions of people who love them, children and grandchildren, partners and parents. This crisis is tearing families apart across the country. In 2018, we began responding directly to this crisis in Pennsylvania, working with Governor Tom Wolf. And in 2019, we expanded our efforts to Michigan, working with their governor, Gretchen Whitmer. Our goal is to save lives and provide people the help they need to tackle and manage their addiction. Our approach has included expanding access to medications, treatment, and harm reduction services. We also have been working to promote a public health approach over a criminal justice approach to drug overdoses. And we've led communications campaigns to reduce the stigma of coming forward for help. Thanks to a lot of great work by our partners on the ground, we've been able to make a big impact and save a lot of lives. Between 2017 and 2019, opioid overdose deaths decreased in both states, even as they increased nationwide. In fact, Pennsylvania had the largest decrease in overdose deaths of any state in the country during that time frame. Tragically, during the pandemic, some of that progress has been reversed. The epidemic has gotten worse everywhere. But compared to the national averages, the increase in deaths has been much lower in Pennsylvania and Michigan. So it's clear that we are making a big difference through a data-driven, state-based approach. But we also know that we have a very long ways to go. So today, I'm glad to announce that we're expanding our work to 5 more states: Kentucky, New Jersey, New Mexico, North Carolina, and Wisconsin, and also pushing for comprehensive action at the federal level. Bloomberg Philanthropies is committing $120 million over the next 5 years, and we've set a clear and achievable goal: reversing this upward trend to overdose deaths with an aim to reduce those deaths by 10% or more in our 7 focus states. Now, it won't be easy to end the opioid epidemic, to say the least, but achieving the impossible is what public health work is all about. That's never been clearer than it has been recently. Public health workers have been on the front lines of one of the greatest challenges the world has ever seen, and they have done heroic work. So I'm optimistic about what we can achieve by working together. And I want to thank you for being so dedicated to this critically important mission and for being with us today. Now, I'm glad to introduce Dr. Kelly Henning, who leads our public health work at Bloomberg Philanthropies. And you're also going to hear from the governors who are our partners in the fight to end the opioid epidemic.
Thanks, Mike. Hi, everyone. I'm Kelly Henning. At Bloomberg Philanthropies, we take a data-driven approach to tackling the most pressing public health challenges around the world. One such challenge is the overdose epidemic here in the United States. Since 2018, Bloomberg Philanthropies has had a targeted, comprehensive response in 2 states that have been especially hard hit by this crisis, Michigan and Pennsylvania. The data shows that together with strong partners on the ground in both states, we've made a big impact so far. One key to that success has been the determined leadership and close partnership of the state's 2 governors, and we're grateful they could join us and reflect on our work together. Here now are Michigan Governor Whitmer and Pennsylvania Governor Wolf in conversation with Bloomberg TV's Romaine Bostick.
We're here at the 4th annual Bloomberg American Health Summit, and I want to thank as well as welcome both Pennsylvania Governor Tom Wolf and Michigan Governor Gretchen Whitmer. Thank you to both of you for being here today.
Thanks for having us, Romaine.
Glad to be here.
Absolutely. And of course, one of the reasons why we're kicking off this summit with both of you is, of course, both of your states were at the forefront and really coming together, trying to address the opioid crisis. Some of the changes that were implemented in both of your states have already shown some results. And I'm wondering if we can maybe start and go back a few years to particularly when this partnership arose. And what was sort of the impetus, not only for the partnership, but for using this money to try to deal with the crisis? And I'll start with you, Governor Wolf, in Pennsylvania.
Yeah, clearly we had a problem. 2017, we had over 5,000 deaths, and the trend was not good. It was up from the year before, and the year before was up from the year before that. And it was a problem that was affecting everybody in Pennsylvania. There wasn't a region that was left untouched. East, west, north, south, rural, urban. It affected men and women, rich and poor. And it was just something that was a bad thing and moving in the wrong direction. And that those 5,000 people, they were people's children, their mothers, fathers, their grandchildren, nieces, nephews, neighbors. There was not one family, I think, that was in one way or another unaffected. So we really had to move. And thankfully, Bloomberg Philanthropies was there to help.
In addition to a lot of the effects that we've had with regards to the families themselves, there was also a big effect here on our first responders and what they were spending their time doing. Governor Whitmer, maybe you can talk a little bit more about what you communicated back in those days with regards to what those first responders were really doing.
Yeah, absolutely. I remember when we announced this, we were sitting in a firehouse with Mike Bloomberg, hearing from firefighters how they're actually were spending so much of their time administering naloxone and not fighting fires, right? And so every one of us is impacted by this insidious, addiction and disease and overwhelming crisis that we've had. Just as my colleague and friend Governor Wolf said, in 2019, we saw a decline in overdose deaths compared to 2018. However, like every state probably, we saw an increase of overdoses in 2020 with the pandemic. We saw a 14% increase in overdoses compared to the 30% nationwide. So ours was less. And I think part of it was because we were transitioning our treatment system from in-person to virtual services. And we implemented programs from across our statewide strategic plan. And it was spearheaded by the Michigan Opioids Task Force. So we know that this is a pervasive problem. We're grateful for the work that Bloomberg Philanthropies is doing with the state leadership. And these efforts include harm reduction and treatment access initiatives. And we're grateful for it because it's making a difference. We've got lots more work to do, but we have seen firsthand the difference that it's making in people's lives.
Talk about some of the changes in the approach.
Well, our statewide opioid strategy has allowed us to address needs from across the continuum of care, focusing on special populations, working to include cross-cutting factors like race and equity. The guiding principle of our strategy is about equity, and it's about elevating voices that have lived experiences and supporting long-term recovery. Our recent effort highlights include expanding access to naloxone. In 2020, we launched a portal for organizations to obtain bulk naloxone orders at no cost. It allows for greater 150,000 kits to be distributed at a time of great need throughout the pandemic. We partnered to provide mail order naloxone for individuals. So yeah, in 2020, EMS's Leave Behind protocol allowed first responders to leave behind naloxone kits with family and friends who were impacted, or an individual at a scene was impacted by overdose. And 60% of our population is covered by this protocol. We've expanded access to treatment too. We removed Medicaid prior authorization for buprenorphine. I know I just mangled that. And in 2020, we got federal approval to change essential health benefits plan to expand access for treatment and access to naloxone. So these are just a few of the many things that we've done that I think has contributed to this improvement.
And Governor Wolf, I'd love to hear about some of the things that you've done there in Pennsylvania, which has really been held up as a model for a lot of other states to follow.
Well, thank you. We governors love to brag about our state. So we saw, as I say, a big increase in 2017. We actually saw a decrease in 2018 and 19 in our opioid overdoses, and I think that had a lot to do with the broad bipartisan support that we pushed forward, so that we actually could do a lot of things. Even though I have a Republican General Assembly, and like Gretchen, we are not of the same party as the General Assembly. But in this case, in Pennsylvania, we all pulled together, and it really made a difference. We set up 50 centers of excellence to actually help sufferers of substance use disorder navigate the healthcare system, make sure they were getting the right treatment. We expanded access to medicated assisted treatment. We actually gave every Pennsylvanian a standing order, the Physician General did in 2015 for naloxone. And I think by 2018, that had become sort of pervasive all across Pennsylvania, all first responders, but even individuals were getting prescriptions for naloxone from their pharmacies. We did things like the prescription drug monitoring program, did a better job of sharing information, so doctor shopping became more problematic, tougher to do. We did a better job in terms of medical education in our medical schools. So all these things work together. I personally did about 84 roundtables to try to move beyond the stigma. And I think all of this worked together to get people all across Pennsylvania to recognize this as a disease that we all had to get our arms around. And I think that made a difference. Obviously, as Governor Whitmer said, the pandemic really brought all of this to a screeching halt, and we all need to get back to work, which is why what Bloomberg Philanthropies did before and is doing now for Pennsylvania is really helpful.
Well, let's try to end this on a high note, and maybe I want both of you to kind of give us a little sense here of your hope, of your optimism for getting this crisis under control, if not completely eradicated. And I'll start with you, Governor Wolf.
Yeah, I want to get back on track. I mean, the pandemic hit us all, and I think so many different types of personal disorders, intellectual disorders, and disabilities came to light during the pandemic. We need to get back on track. We know we can do it. We're going to do the same things that we did before and get our arms around this crisis, because we actually have to do this. Again, Bloomberg Philanthropies is a big part what we're doing here in Pennsylvania.
Governor Whitmer.
I agree with my friend, Governor Wolf, on all those regards. And I would just share that. I think, we know what works. We're working together. I think as we work to eradicate opioid use disorder, it's so important that we are locked arm in arm, that we're following the science, that we're putting people at the center of our policies and our efforts, and that we are taking the politics out of the conversation, because this is about our individual health, it's about our community health, and it's about our greater economy. The one undeniable thing I think from this last 2 years is that health and economy go hand in hand. And the efforts that we're working on together with Bloomberg Philanthropies and stakeholders across our state is really making a difference. We got more work to do, but I'm grateful, and I'm absolutely going to stay focused on this.
I think that's a great place to end it. The health and the economy, of course, go hand in hand. And one of the reasons why we are kicking off this summit with both of you is because both of you have really shown a tremendous amount of leadership on this issue, and others really setting an example for a lot of other governors around the nation. Our thanks here to Pennsylvania Governor Tom Wolf and Michigan Governor Gretchen Whitmer.
Thanks, Romaine.
Thank you.
Many thanks to our partners, Governor Whitmer and Governor Wolf, for joining the summit and sharing their insights. Michigan and Pennsylvania have shown that progress is possible in the fight against the overdose epidemic. Of course, there's still much work to be done. As you heard Mike announce, Bloomberg Philanthropies is expanding its ambitious work to 5 more states. We're excited to hear from their governors. Let's hear from them now. Here are North Carolina Governor Roy Cooper, New Mexico Governor Michelle Lujan Grisham, and Wisconsin Governor Tony Evers.
So, Governor, first, what interventions are you most proud of that your state has implemented to ensure that people with opioid use disorder have access to medication treatment and harm reduction services?
Well, first to Bloomberg, the foundation, and to you, Dr. Henny, thank you very much for including me. It's exactly these kinds of conversations that lead to stronger policy efforts state to state, and frankly, a stronger national framework. I think an area where New Mexico has been seen as a leader is really trying to get right effective treatment, including outpatient treatment. For particularly significant mental health issues and diagnoses that really require not only prescription drug treatment often for success, but also having providers available. And during COVID, we really expanded what we were doing in telehealth and telemedicine. We see it as a giant step in the right direction, no matter how remotely you are living or how scarce our healthcare resources are, with or without a pandemic.
We are proud of the work that we've done in North Carolina. In fact, a few years ago, we put together an opioid action plan. We were concentrating on evidence-based treatment that we know works out there. We've also focused on people who are in our prisons or otherwise in our justice system. We know when you go through a prison, a lot of people are there because of their addiction treatment. And we know that most people in prison are going to be back out in society again. So we have concentrated treatment there that also follows outside when you leave prison walls. We passed something called the STOP Act, which greatly reduced prescription opioids. And we're really proud that before the pandemic, we were really turning the corner. The number of ER visits, emergency room visits for people with overdose was declining, and the number of deaths was declining. But then the pandemic hit. And so we know we got a lot more to do.
The piece that we're most proud of is we've established a hub and spoke model. We're really excited about that. It provides a continuum of services with the hub being, if somebody needs to be have very significant services that might keep them overnight, keep them in a place for a period of time. Two, as people move out of that issue of being really severely impacted, to others to support. So I feel very proud about that.
What would you say your biggest lesson learned has been over the last 2 years in this area? What would be the thing that you'd want to make sure to mention?
Yeah, I think it's really put a light on the fact that we have to really attack the underlying disease of addiction and do everything that we can to try to remove the stigma. When someone has a heart attack or cancer, families are bringing over the meatloaf and everybody comes to the aid. When there's somebody with substance use disorder or addiction issues, people scatter. And a lot of that is because of the stigma that is out there. And we've got to realize that this is, in fact, a disease that we have to treat head on. I'd also say to everybody that everybody has a role to play. Local governments, medical providers, faith-based groups, family members, everybody has to have a role in fighting this disease of addiction that's out there.
The lesson I've learned, certainly as a governor, that this is a priority area. It saves lives. It saves whole families. It sustains relationships. Without those relationships, not triggers, but relationships, there's no such thing as long-term recovery or resiliency. My advice is this country is going to have to really treat this as the public health crisis it is. And COVID-19 has taught us there are real public health crises amongst us in a number of ways. And I don't want to trade one for another. I want to embrace that all of them can be attended to by focusing on the right stuff in the right ways.
People are more willing to talk about behavioral mental health issues than ever before. They're more willing to not hide addiction issues than ever before. People are concerned about it. And so that gives us, unfortunately, a horrible impetus to be more aggressive about it.
What about looking ahead? What do you see for the future? What are you going to be concentrating on in the next year or two, presuming this COVID pandemic will be still with us for a bit longer?
It's time for us to take advantage of a horrible situation and make sure that we have the services available for people as close to home as possible. If you think through this, as someone that's addicted in northern or northwestern Wisconsin, the idea that somehow they're going to have to travel to Milwaukee, which is like a 5-hour drive, to receive those services, that just isn't going to work. I mean, simple as that. We need an all hands on deck effort, and I think we're poised to do that here in Wisconsin.
Well, first, I want to get Medicaid expanded in my state. We've come so close a number of times, and I'm in the middle right now as we speak of a budget battle, and Medicaid expansion is part of that focus. In the future, we want to funnel our resources and do everything that we can to treat this like the disease that it is, because anybody who has had this as part of their family, we know it's hard on the person who has the substance use disorder, but family members sometimes get hit even harder because it is so difficult to deal with. We know it's a process, that addiction treatment is a process that happens over a period of time that, we want to make sure that we can provide the services that we need to help those people and to help their families as well.
For me, it's really important that we figure out sustainable housing and career education and family support mechanisms that are treatment models in their own rights. What governors need is every idea that we know transitions this country into a brand new, aggressive framework to really do the heavy lifting that's required in this moment. to make sure that we make the differences that we know that we can make if we have all of our supports and tools working together productively.
Thank you again to all the governors for taking the time and for their strong leadership in combating the overdose epidemic. We look forward to sharing some of the results of our continued partnership at next year's summit. And now I'm going to hand the program back to Josh Sharfstein for a status update on the COVID-19 pandemic. Josh?
Thanks so much, Kelly. It's so great to hear governors talking about tackling the overdose crisis. They understand that public health challenges do not go into hibernation during a pandemic. To the contrary, what we've learned this year is that pandemics make a lot of problems worse. Why? The isolation of the pandemic causes stress and anxiety. The economic effects of the pandemic keep people from meeting their basic needs. The control measures for the pandemic complicate the delivery of care and other services. And the political polarization sparked by the pandemic holds back effective policies. If the pandemic seems to make a lot of problems worse, it follows that progress tackling COVID-19 should, well, if not make everything better, at least give us some reason for hope. So how are we doing? In recent days, the U.S. death toll from COVID-19 passed 750,000. 750,000. The world's death toll is more than 5 million. Every day, the U.S. still sees about 75,000 new infections and more than 1,000 deaths. And yet there is reason for hope. We have vaccines newly authorized down to age 5. Vaccination rates are rising in the U.S. and around the world, albeit slowly in too many places. About 3 in 5 people are fully vaccinated in the U.S., about 2 in 5 around the world. Effective medications to prevent hospitalizations may soon be available. What we do now to protect our communities and to support the global vaccination effort matters. We can push COVID-19 further and further into a box. We just need to stay inspired. That's why it's my honor to introduce Admiral Rachel Levine, the Assistant Secretary of Health of the U.S. Department of Health and Human Services, for a few words. The former Health Commissioner of Pennsylvania, Admiral Levine is a public health expert, a pediatrician, and the first transgender 4-star officer in any of the country's 8 uniformed services.
Good morning. I am Admiral Rachel Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Thank you so much for inviting me to join you today. You know, we have all faced a very difficult and challenging time. COVID-19 has been taxing physically and mentally, especially among our country's most vulnerable populations. But we've all felt the strain. COVID-19 was particularly challenging for public health professionals, like many of you. Our work was suddenly front-page news, and it was our responsibility to lead the pandemic response at the federal, state, and local level. While it certainly can be disheartening to see a public health issue become politicized, I want to tell you that your work matters, your time matters, and you matter. I want to pause and thank all of you from across the country, your staff, and by extension your families, for the extraordinarily difficult work you've been doing since January 2020, supporting the public health response to the pandemic. You have my personal gratitude, as well as the gratitude of the entire U.S. Department of Health and Human Services. One important lesson of the pandemic is that we are all interconnected, and we need to ensure that a healthier future includes eliminating health disparities and promoting health equity. Despite the heavy toll it has exacted, COVID has also reminded us of a fundamental truth, that we all need each other, that our happiness and literally our survival depends on our connection to one another and to our community. That spirit of community is what makes our country great. and it is what we need now more than ever as we seek to bring this pandemic to an end. Another important lesson is the profound importance of public health. We must ensure that local, state, national, and international public health authorities have the resources, the workforce, and the IT capabilities necessary to protect the health of our nation and the world moving forward. I take time in every presentation to encourage everyone in the audience to get your COVID-19 vaccine and help others in your community get vaccinated as well. The more people that are vaccinated, the quicker we can put this pandemic behind us. The COVID-19 pandemic has also brought into even sharper focus the health disparities of the Black, Latinx, and American Indian, Alaskan Native, and other historically underserved communities. The fact that this pandemic has affected some communities far more than others also underscores the profound disparities in health that have plagued our nation for far too long. While we work to tackle the pandemic, we will not take our foot off the gas when it comes to preparing for any future public health challenges. We must invest in growing our nation's public health workforce today to better meet the needs of tomorrow. And as we work to expand talent, whether it's in the field of health communications or public health informatics, we need to do that with an eye towards promoting diversity. I would like to highlight the importance of diversity. Diversity for a school, a medical center, a business, and government, in every organization. I strongly feel that diversity, in all of its myriad and wonderful aspects, should be welcomed and even celebrated for the way that it strengthens and enhances any organization. I encourage you all to embrace and emphasize diversity in your current roles. All Americans deserve services that are timely, affordable, accessible, equitable, and high quality. Of course, these are our family members, our friends, our neighbors, students, and co-workers. As a nation, we can and we must do better, and we will do better. Now, illness, deaths of loved ones, and prolonged social isolation as a result of the pandemic have impacted lives across the world. The accompanying stressors and trauma have also had unique implications for substance use trends and among people with substance use disorders. So I would be remiss if I did not briefly touch upon the overdose crisis facing our country. Today, people living in America are being harmed by a wide variety of substances, most notably synthetic opioids like synthetic fentanyl compounds, but also stimulants like methamphetamine and cocaine, and other drugs often used in combination. HHS recently announced a new overdose prevention strategy that fully addresses the spectrum of drug use and addiction that can result in overdose and death. The new strategy focuses on people, accelerating and amplifying access to proven opioid use disorder treatments, overdose prevention interventions, and other diverse substance use treatments and supports, while continuing to develop new, innovative solutions. In conclusion, I also urge you not to forget to take care of your own mental and physical health during these challenging times. A valuable lesson that everyone needs to remember: take time to care for yourself too. Now, I am a positive and optimistic person, and I believe that we can work together to come out of this stronger and build a better future for our nation's health. Thank you.
What an exciting announcement earlier. Good morning, everyone. I'm Shane Bryan, Partnership and Engagement Officer with the initiative, and I'm coming to you from the Johns Hopkins Bloomberg School of Public Health right here in Baltimore. I'll be with you throughout the summit. Be sure to engage and participate in the chat by telling us where you're tuning in from, topics you would like to hear, and which speakers you're excited to hear from. Join in on the conversation by following us at American Health on Twitter and by using hashtag Bloomberg Health Summit. We want to hear from you, and we'll have polls for you to participate in throughout the summit. Up next, we have our first panel on social discord and the future of public health that will touch on challenges and successes within health departments amid the pandemic.
Hi, everyone. I'm Beth Resnick, Assistant Dean for Public Health Practice and Training at the Johns Hopkins Bloomberg School of Public Health. So I'm here today to talk to you about actually a very unfortunate topic about a lot of the harassment, threats, and violence that our public health officials are facing across the country. And as we know, the pandemic has brought greater appreciation by many to the importance of public health and the people who work in the field. However, many health department leaders and their staffs have experienced threats to their jobs, their safety, their family members. These threats have come from their own community members, from organized anti-government militias, and even their politicians who are supposed to be leading. So today I have the pleasure of being here with Drs. Khaldoun and Bukani McKenney to share a little bit about their own experiences in working in public health. So let me turn to you, Dr. Bukani McKenney, and can you share a little bit about a day in the life of a health officer? And thank you for all of your hard work throughout this pandemic.
Absolutely, Beth. Thank you so much for having me. Pretty much these days, it is still exhausting. It's a different kind of exhausting because last year we didn't know what we were doing. We were trying our best and we worked with the information we had. Now we're really focusing on vaccines and testing and educating and combating the misinformation out there. And so it's a different type of exhausting. That along with being a family physician, a frontline worker, doing the actual swabs, taking care of people in the hospitals. It is a lot of work, but it is meaningful work.
Well, again, thank you for your service. And how about you, Dr. Khaldoun? Can you tell us a little bit about your experiences?
Absolutely. I mean, I can say for myself, as well as the many public health staff people and leaders who have been working on this really since I'd say at least January of 2020, well before anyone heard about some of the first cases in most parts of the country. Public health teams have been working on this since then. And it has been, as Jen said, exhausting. I more recently, in recent weeks, left my position there for a new opportunity, but I can say that it's been exhausting. And our teams have been responding not only to COVID-19, but all the other crises and public health needs in our communities, whether it's lead, Legionella, the opioids crisis. All of our public health teams are still working on that in addition to COVID-19. So it certainly has been exhausting.
Well, that's a great point about all the other things that you have to do on top of COVID. It's not like we can forget all of those. So let's turn a little bit more. I wanted to ask you a little bit more about your workforce and how they're holding up. So we've heard the bigger numbers are always about the health officials who've left their jobs. The statistics show over 300 have left their posts, and 1 out of 5 Americans have lost their public health leader. But the ones to the lower, not the leadership, the next level down, it's a little bit harder to track. We found in some of our research that over half of the health departments that had responded to our survey said they were experiencing some sort of threats or harassment. People were feeling disillusioned and morale. The CDC found last spring, 26% of public health worker respondents experienced stigma or discrimination because of their work. They felt bullied, threatened, and 12% had received job-related threats. So please tell us about your staff. And again, thank them for all of their great work. Jen, do you want to share a little bit about how your staff is holding up?
Sure. I'm a health officer in a county of about 9,000 people. And so our health department has 4 full-time employees. So it's a small one, but really with the 4 employees, they've been doing all the work, all the contact tracing, all the vaccinating, everything, and in addition to all the usual, vaccines and WIC and everything else that we expect our health departments to do. So unfortunately, from the time the pandemic started, we have had turnover of 3 of those 4 employees, and we are working on finding our 3rd health department administrator in the last 6 months. So we are still without an administrator at this time. I can tell you our staff has been some of the hardest working people that I've ever met, I guess. They're working evenings, weekends, and it's just been unbelievable under these circumstances. So it really is amazing to watch, but they are strained right now.
Yeah. So Janae, how about for your staff?
Similarly, in the state of Michigan, we actually have 45 kind of local or county health departments. And since the pandemic started, 8 health officers and 9 medical directors, that's senior leadership, have left, resigned, or retired, which is significant. And I'll tell you what's been most concerning over the past several months in Michigan is that they've had their lives threatened. They've had people come to public meetings and verbally abuse them, physically threaten them, put their addresses out in social media and encourage others to physically or verbally assault them. It's quite concerning. We've had some of our local elected officials actually remove money and funding from local health departments if they do anything when it comes to COVID-19 recommendations or requirements for simple things like masking in schools. So it certainly is concerning, and we're concerned about the staffing situation across the entire state.
That sounds pretty brutal out there. We are forming a coalition here at Johns Hopkins called the Stop Coalition to stop threats and harassment against public health workforce. There's definitely a huge interest to support the workforce, and we all need to think about how we can address that. We will put up a link to our site, We Stand With Public Health, that talks about advocating for better protections, legal and law enforcement connections, and building a better public health infrastructure, giving our workforce better equipment and supports to be able to do their jobs. Another interesting fact that I want to close on actually is that, interestingly, we've also seen an inspiring uptake in interest in public health. Again, people know about public health, understand the importance in a way that they have never had before. We've had over 20 to 30% increase in applications to schools of public health across the country. I know here at Hopkins and at other schools of public health we're bursting at the seams with students. So I guess I'm thinking about looking towards the future. What do you see? How do we get out of this? How are we going to be better prepared for the next pandemic? Janae, you want to share your thoughts?
Sure, those are certainly encouraging stats that you read off. I'd say one of the silver linings of the pandemic is public-private partnerships, and how we know that so many private entities have played such an important role in fighting the pandemic. So I think that's really, really important. And also making sure we fund long-term public health and public health departments. We have some federal dollars coming in across the country to states and municipalities, but we hope that lasts beyond just the next couple of years. We really need sustainable funding for our public health departments.
Great points. Jen, what are your thoughts?
Absolutely agree that we need more funding and more support, not just financially, but really support through the legislature and everything for public health, because that's really where we're hurting right now. I'm so excited to hear that students are seeing the work that we're doing and wanting to take up that challenge to work in public health in the future. And for them, I want to say that it's worth it. It really is. Public health, even though it's called public health, is very personal, and it really makes a difference with every single person's lives that you touch. And so the science, the data is important, but never forget that the public health that we're doing is truly about the people that we serve.
Thank you both. What an inspiration. And again, thank you to all your staff. And for the rest of us out here, please go to the We Stand With Public Health. We've got to work together to make this better and do better, be better prepared for our next pandemic. So thank you both. And it's been a pleasure talking with you.
Thank you.
Greetings, my name is Adam Abadir, the Communications Director for the Baltimore City Health Department. It's my pleasure to also introduce Benjamin Young-Savage, our Social Media Consultant and Creative Director. The COVID-19 pandemic challenged our public health agencies across the country, but our ability to communicate clearly and effectively in an age of organized misinformation was a particular concern for the Baltimore City Health Department communications team. For the majority of 2020, communications were focused on introducing new concepts to Baltimore City residents to prevent disease transmission: social distancing, mask wearing, and washing your hands. However, after a year of these campaigns, our followers on social media began reaching out for advice on how to have harm reduction conversations with friends and family members who, for any number of reasons, were not inclined to follow the latest public health guidance. Shorty, pull your mask up, a quip given at a press conference by Baltimore Mayor Brandon Scott to community activist Shorty Davis, whose mask had fallen from his face, provided an opportunity. After watching this interaction go viral, we realized that by introducing harm reduction best practices using authentic language and a dash of humor, we could arm our followers with information that followers could then share with friends and family members, both on social media, but also in group text threads and real life conversations in order to influence decision-making and model behaviors. Conversations with BCHD epidemiologists, contact tracers, data analysts, and community canvassers gave us insight into what specific behaviors, activities, and beliefs were contributing to increases in new cases and later slowing vaccination efforts.
We also use information freely shared to us by our detractors on social media to create campaigns that targeted specific misinformation about what could prevent COVID-19 transmission. Salads, green tea, and ginger ale, all unfortunately are no substitute for getting vaccinated. Through memes and engagement in comments across our social media, the Baltimore City Health Department establishes a voice for itself and for the city. While always being willing to educate and provide information, we also push back on trolls, distinguishing between individuals who have questions and those who decided to do their best to hinder the healthy habits of Baltimore City residents. Baltimore has a unique character, one of grit, but also one of compassion. We look out for each other and band together to face our common problems. Our tagline is Baltimore versus COVID, and that's exactly what we mean. A common problem will require all of us to support one another. We reserve the right to clap back with love, snark, and maybe a gif or two on those individuals who purposely chose to sow doubt on public health best practices and the importance of vaccination. In doing so, we draw a line in the sand. You can try that with other public health agencies, but it won't fly in Baltimore.
I have truly enjoyed following the Baltimore City Health Department's social media, and they're doing such a great job of getting out fun, yet critically important messages. Y'all are doing it up in the chat. Keep it going, and thanks for responding to the poll. Again, keep an eye out for more opportunities to engage. All right, next up, let's look at how we can advance equity while setting the agenda for a post-pandemic world.
Hi, I'm Sharice Davids, representative for the 3rd District in Kansas. In 2019, food insecurity in America was at its lowest level ever, but disparities existed. The rate of food insecurity for people of color was nearly double the rate of white non-Hispanic people. And when the pandemic hit, grocery stores closed and millions stayed home to help reduce the spread of the coronavirus. An estimated 45 million Americans were food insecure, including 15 million children. The pandemic reversed gains and exacerbated disparities. It also showed us how connected food is to other issues, from health and economic development to climate change and racial equity. That's why we worked really quickly to get relief to those in need. The American Rescue Plan included $12 billion of food assistance programs, even programs that weren't directly focused just on food, like the expanded child tax credit. You know, the expanded child tax credit had tremendous positive impact on hunger. These were, of course, emergency measures, but they demonstrated that food policy has far-reaching impacts when it comes to equity. And as we seek to move forward, we have to take that lesson to heart. We have to redouble our efforts to promote equity, particularly when we're talking about food policy. And we have to build systems that are going to address the growing threat of climate change so that we can continue to make policy that's really going to meet the moment that we're in. So I appreciate you all taking the time to listen, and I'm looking forward to seeing you soon.
I'm Lisa Hamilton, President and CEO of the Annie E. Casey Foundation. The child tax credit is a game changer for millions of families, helping them meet their basic needs. The expansion of the credit as part of the federal pandemic relief response is an extraordinary opportunity to reduce child poverty in a way that was unimaginable just a year ago. It's also a critical tool to advance racial equity as we emerge from a health and economic crisis that's had a disproportionate impact on children and families of color. The credit is expected to lift 4 million children out of poverty, a 40% decrease in just 1 year. And many of those children are children of color. We can already see the difference that the credit is making. It's allowed parents to put food on the table, keep a roof over their heads, keep the lights on, buy clothes and school supplies, and even save for emergencies. But while we're celebrating this progress, it may only be temporary if we don't permanently expand the credit. Our nation's leaders have the opportunity to make choices that can set a new standard for child well-being. Permanently expanding the child tax credit will position us to turn the tragedy of the pandemic into a promise for a better and more equitable future for the next generation.
Good morning. My name is Michelle Spencer. I'm the Associate Director of the Bloomberg American Health Initiative, and I am pleased to be joined this morning by Dr. David Carlisle, Charles Ardrey University of Medicine and Science, and President James Hildreth from Meharry Medical College. This morning, we'll be talking about reducing health disparities by advancing equity. And I have just a few questions for our panelists. We know that data is at the core for advancing evidence-based public health. How can we leverage data disaggregated by race and ethnicity to ensure access to health disparities and access to health is equitable?
So thank you, Michelle, for being a part of this important conversation. The first thing is we have to collect the data on these different minoritized groups and make sure that those data are used to distribute the resources we have available to us. The problem right now is that we're not collecting disaggregated data for many of these minoritized groups in our country. We have to do that first and make sure that gets done and hold accountable those organizations responsible for doing so. But we cannot have effective healthcare policies or public health policies without the data. It's as simple as that.
You know, thank you for that. Dr. Carlisle, we use data to develop policies to advance the work. Dr. Hildreth just mentioned that we have to collect the data. Share your thoughts on the importance of collecting data, particularly in minority communities.
Well, for years, decades, even generations, we've had anecdotal knowledge of healthcare disparities. You talk to a person on the street and they would say, yes, the healthcare system discriminates against me. But it wasn't until we started collecting data that we actually could measure and quantify healthcare disparities. And once they could be quantified, indisputably, we were able to start taking action because people couldn't ignore the presence of healthcare disparities. The data made those disparities no longer anecdotal. They made them something that policymakers couldn't help but focus on. And that just shows the importance of collecting data.
Can you talk a little bit about advancing health equity? We know that it requires a multi-system reform approach, but what would you consider to be the most important first step to facilitate change?
Well, I would say one word: commitment. We need to sustain our commitment to driving forward to eliminate healthcare disparities. We've made great strides recently because we have been committed, and we need to sustain and maintain that commitment to continue to move forward because disparities still exist, gaps still exist, and opportunities to improve our healthcare system still exist.
So Dr. Hildreth, we just heard from Dr. Carlisle this commitment, right? But who is this commitment from? There's multi-systems that are involved in this. Who would you say this commitment is required of and coming from?
Well, it has to be required of the governmental agencies and that are involved in delivering healthcare and public health. The large systems in our country, both academic and private and public, need to be committed to this. Without the commitment across all those organizations, this is simply just not going to happen because all of them have an impact on the health of the populations that we're talking about. So the commitment is widespread and has to be uniform across the board.
Thank you for that. I wonder if you would comment, Dr. Hildreth. We know that COVID-19 exposed health disparities that have been present for hundreds of years. Mm-hmm. How can we optimize this moment to really move beyond conversation and really make impactful policy change to directly address some of these gaps?
I think it comes down to accountability. We have to hold those accountable who can impact the health of the populations in question. That means large healthcare organizations, even the agencies responsible for this. We have to hold them accountable. And the accountability must have some consequences for failure to achieve the goals we have. So I think accountability is key to this.
So we heard the importance of collecting data. We heard commitment, and we've heard accountability. Dr. Carlisle, what would you say as a final thought?
Well, I say one more thing. We need to make sure that our healthcare workforce is not only accountable to the populations that it takes care of, but represents and includes those populations. That's how we make big change in our healthcare system.
Thank you both for joining me this morning.
Thank you.
Thank you.
It is now my pleasure to present our keynote speaker, Reverend Dr. Howard John Wesley. Reverend Dr. Howard John Wesley is the exciting, gifted, and anointed senior pastor of the historic Alfred Street Baptist Church in Alexandria, Virginia. He is the 8th pastor in the church's 217-year history. Dr. Wesley speaks and acts to acknowledge social justice, racial justice, and equity. He led community protest marches against the New York Grand Jury's 2014 decision not to indict a New York police officer whose chokehold led to the death of Eric Gardner. His subsequent sermon, When the Verdict Hurts, was acknowledged in Time magazine's July 29, 2013 cover story. 3 of Dr. Wesley's sermons, When the Verdict Hurts, A RISPA Response, and Tell Your Own Story, have been archived in the faith-based collection of the National Museum of African American History and Culture in Washington, D.C. Dr. Wesley has received many honors and commendations, including the 2016 NAACP's Chairman's Award for his work in social justice. Dr. Wesley, thank you for joining us today.
Hi, I'm Pastor Howard John Wesley from Alfred Street Baptist Church in Alexandria, Virginia, and very grateful for the opportunity to be part of this Bloomberg American Health Summit. Back in 1989, a very close friend of mine went to the doctor for some back pain that he'd been experiencing for several weeks. After the initial meeting with the doctor, some tests were ordered because the doctor didn't know what was causing the pain. And when my friend went through those exams, they found a mass on his liver. A biopsy was performed. It came back to be benign, but still had to be removed. And to this day, this is one of the things he would tell you. He says, I'm thankful for the pain in my back because it exposed a possible cancer in my liver. In his mind, the pain exposed something else that had to be dealt with that ultimately could have saved his life. I think the same can be said about COVID-19. This pandemic and all the pains it has caused us has also re-exposed a cancer within American society that must be dealt with. COVID-19 has been an eye-opening experience for us as a nation and as a world. But sadly, too many people have still gone through it with their eyes wide shut. This pandemic has exposed some things that really are unsightly about us as a society. It's exposed our selfishness and how people are unwilling to sacrifice personal privilege for communal safety. How we hypocritically divorce personal liberties from public health. An unwillingness to wear masks. Oppositions to getting vaccinated. Attending events where COVID is spread and mutates and another variant comes out and we're not able to get control of this thing. And as a result, this pandemic has made us more aware and conscious of public health, of the responsibility each one of us has, you have, I have, towards a greater communal well-being. And with that awareness of public health, we are also forced to deal with the intersection of race and public health practices. This pandemic has exposed the systemic racism that intersects with public health. It was Harvard scholar Derek Bell in his book Faces at the Bottom of the Well who argued that racism is inextricably woven into the fabric of American society. That there is no corner of our world, no corner of our nation, no part of our policies that are not touched and affected by race. That is true even of public health. As a matter of fact, in the last year alone, some 35 states have made over 200 declarations identifying the connection between race and public health and understanding that racism is a public health crisis. But sadly, too many Americans don't see it and fail to recognize it or name it. But race and public health, they intersect when you look at communities of color that are in food deserts, where the water is still poisoned with lead, where fast food is abundant, but fresh produce isn't, where liquor stores are innumerable, and our children are raised in food insecurity. Just look at how many Black and brown children are dependent upon school lunch programs to have a decent meal. And how can you be healthy if you don't have food security? Race and public health intersect. When you open your eyes to the reality of a criminal justice system that harshly incarcerates Black and brown bodies for substance use disorder over substances that now white corporations are making money selling legally. It's a health issue. When you look at how our government can pass a Juneteenth holiday, but fail to pass the Emmett Till anti-lynching law and substantive gun reform that could protect us from another mass shooting or school shooting or another lynched Black and brown body. Health and race intersect. When you see voting rights being suppressed in Black and brown communities, robbing its citizens of the ability to vote, to choose those who choose the judges that pass the sentences, and when we don't vote, we are ineligible to be part of the jury pool, which means we have no voice in the indictment of officers that have killed innocent, unarmed Black and brown bodies. Race and public health interact. Race and public health meet up when parents are forced to choose between going to work and staying at home for children who now have to do online schooling, but they don't have tablets, they don't have devices. So they're doing homework through an iPhone connected through a cell signal because there's no Wi-Fi. And without correct Wi-Fi, there can be no telehealth. How can you be healthy if you can't even meet with your doctor? Race and public health interact as you see vaccine hesitation and resistance among communities of color. Why? Because they remember the Tuskegee experiment. And they remember the exploitation of Henrietta Lacks. And therefore, within these communities of color, there's systemic race issues that cause them to be hesitant and resistant to medical treatment. All you need to do is look at the disparity in access to COVID-19 testing and treatment and mortality rates. And the data shows that race is in play. You can't demonize data. You can't demonize data. I'm going to say it one more time. You can't demonize data. And our pursuit of public health demands that we not only confront COVID, but we also deal with race. That we embrace scientific data with open arms. That we address racial health inequities. That we uncover the key issues that link systemic racism to the health and well-being of indigenous, Black, and Latino communities, and develop actionable solutions for positive change at the federal, the state, the communal, the organizational, and even the personal level. Pursuing public health is pursuing justice and racial equality. And this health summit and the initiatives of the Bloomberg American Health are a major first step in having the discussions of race as a public health issue and developing the solutions to fight and dismantle racism in our society. The pain of this pandemic has re-exposed the cancer of race, and we must treat them both.
Good morning, and thank you for joining us as we discuss community-level approaches to advance health equity. I'm Michelle Spencer, Associate Director of the Bloomberg American Health Initiative, and I'm joined this morning by Bloomberg Fellows Erin Franey from the Food as Medicine Collaborative in San Francisco, California, and Victoria Adewumi from the Manchester City Health Department in Manchester, New Hampshire. We're going to jump right in this morning, and I'm going to start with you, Erin. You're working on a unique program called the Food Pharmacy Program. Can you tell us about it and its impact and how it has helped communities?
Yes, thank you so much for having me here this morning. It's truly an honor. The Food Pharmacy Program was designed by the Food as Medicine Collaborative to comprehensively address patient food insecurity, support nutritional behavior change, and advance health equity. So the program is co-locating healthy groceries, cooking, nutrition education resources, connections to other food resources within the clinic setting, and also helping for patients and for clinic staff to really draw that connection between what patients are eating, their diet, and their health outcomes. And so this is really about transforming healthcare for both patients and clinic staff, for healthcare systems to really understand those connections and recognize that clinical care is maybe about 20% of what impacts a person's health. So much of it is these underlying social determinants of health, food being one of them, and that we see this program as a way to take a really important step to helping support patients' health and well-being, especially patients who have faced significant barriers to good health because of ongoing health inequities and health disparities. And I would say a second impact it's had on the communities we work in is, these are clinics that a lot of our patients have been going to their entire lives. They have strong relationships, but there's also a history of distrust and abuse within the healthcare system for communities of color. And so a part of what is also happening here is working to really repair and rebuild trust. And we hear that from patients all the time. And I think that's a huge part of this program.
Yeah, Erin, it sounds like there's the social and medical approaches that you are using to really advance health and reduce those disparities. I wonder, I'm going to shift to you, Victoria. Can you tell us a little bit about the Manchester Community Schools Project and the impact that it has had on communities, particularly adolescents? I understand that the program has had some success with the Robert Wood Johnson Foundation Health Prize. Can you talk a little bit about that?
I would love to, and thank you so much for having me. It's a pleasure to be here with you and Erin. And the Manchester Community School Project, something I'm so professionally and personally proud of. It looks like co-locating resources and services directly in community through schools. So we think of our schools as really neighborhood hubs or hubs of transformation. We know that health happens in community. And so we have, with our incredible network of service providers, co-located everything from fitness classes to financial literacy to parenting classes, food programs. It really runs the gamut of social determinants of health-related programming. And we think of schools as these kind of incredible incubators because they are within walking distance. Folks can easily access them. They feel like familiar environments. Folks often either have a child or at least are somewhat familiar with their neighborhood school. And we're able, with the partnership with community, to really stand up programs that support families, which in turn supports adolescents.
Thanks for that, Victoria. When you talk about the partnerships with the school system, I want to throw it to Erin and ask, why is the intersection between healthcare and food insecurity so important, as we've just heard from Victoria, in terms of the importance of community partnerships?
Yes, I think healthcare has a huge role to play in addressing food insecurity and other social determinants of health. And I hope that's where these systems are moving. And that's in huge part, as we've been discussing, that, a person's diet does have a large impact on their health, and folks who are food insecure, it's associated with worse health outcomes, particularly with a variety of chronic conditions. And so what we are trying to do as the Food as Medicine Collaborative is really bridge these two systems so that healthcare can embrace food insecurity as a health issue and be able to help address patients' needs beyond that kind of more purely medical clinical care?
Well, I thank you both for joining me in conversation. It certainly resonates the work that you're doing, that these are opportunities to really use local community-based efforts to really advance the health of communities. And I will say, you each mentioned transformation, and I think that your programs are certainly transformative with the role that you're doing and the work that you're certainly doing. And we so much value you and appreciate you for all of your efforts. Thank you for joining us today.
Good morning, everyone. I'm delighted to join you for this year's Bloomberg American Health Summit. COVID-19 has been described as history's first data-driven pandemic. Even in the earliest days of the pandemic, data was amassing at a truly staggering rate, much of it generated by scientists and public health experts who were publishing tens of thousands of papers on the virus, sharing information and guidance in the media and with local and national governments, and revealing the disparate impact this disease was having across lines of income and race. Research universities quickly proved to be instrumental players in the effort to make data available and legible to the world. Take the Johns Hopkins Coronavirus Resource Center. Anchored by the now iconic dashboard developed by Hopkins engineering professor Lauren Gardner, this site aggregated and rigorously vetted data about spread, testing, hospitalizations, deaths, and later vaccinations from around the globe. At the same time, other universities from MIT to the University of Washington to Oxford were also working to stem the tide of the pandemic through research and data. Together, these efforts constituted a realization of one of the critical roles that universities play in democracy: cultivating facts, making discoveries, and communicating reliable information to the public and policymakers to help shape sound policy. The early months of the pandemic were thus a moment where we were making our work, in the words of today's theme, truly visible. And there were real indications that we were restoring trust in our enterprise. One compelling data point surely has to be the sudden and surprising rise to celebrity status of the director of the National Institute of Allergy and Infectious Diseases, Anthony Fauci. But there was also, we know, a dark side to the information overload of the pandemic. Evolving and sometimes contradictory public health guidance, high-profile retractions about experimental drugs, and decontextualized data about vaccines, to just take a few examples, all fueled what the World Health Organization has termed an infodemic. This not only made it hard for individuals to find reliable information, but also hindered public health responses and created the conditions for misinformation and conspiracy theories to flourish. The infodemic was only exacerbated by and also helped to accelerate political polarization, which in the United States was already at historic highs. And as we know, hyper-partisan responses to the pandemic have quite literally cost millions of lives and endangered our democracy by further diminishing the public legitimacy of basic facts. But for me, the partisan distortions of academic research and the sporadic missteps of experts are not an argument to close off academic research and insight from the public. Indeed, I think one of the critical lessons of the past 20 months is that we must not shy away from, but truly embrace openness and visibility. At the same time, we have learned, often the hard way, that we need to be acutely aware of the risks of unfettered openness. The data we produce and verify, the insights and recommendations we draw from that data are a vital public resource. But there is little room for error. Given the velocity of social media, even isolated mistakes or corrections have the power to feed misinformation campaigns and to undermine the legitimacy of facts and expertise. It falls to universities like Johns Hopkins and other research institutions to build guardrails to ensure that reliable research and insights reach the public in a timely and open manner while also meeting the highest standards of academic integrity. Part of this commitment to openness must also involve direct contact and exchange with the people, communities, and policymakers who would most benefit from them. Our insights cannot be delivered from on high, but must be in constant conversation with the communities and stakeholders they affect. The Bloomberg American Health Initiative has demonstrated one powerful model for how this can work in public health through the Bloomberg Fellows, many of whom are here with us today. This cadre of fellows represents a growing network of expert practitioners who are not only trained in leading-edge approaches to public health work, but also embedded in communities and organizations. They are bringing the best of the academy and the grassroots to bear on public health work in a way that advances equity through evidence. The Bloomberg Fellows, their organizations, and our faculty, along with all of you who have joined us today, remind us that academic research, at its best, has the power to advance not only human knowledge, but also the common good through rigorous science and expert public health scholarship that shapes sound policy. Our democracy and our world stands at a critical juncture, and it is incumbent upon universities like ours and experts like you to seek out new ways to make the extraordinary work undertaken within universities more open, more accessible, and more impactful for the world. Thank you, and enjoy the rest of the summit.
Thank you, President Daniels. All right, everyone, remember, we're at American Health on Twitter. We're live tweeting the entire event. Come on and join us. Now, let's look at the importance of data and lessons learned from COVID-19, starting with Dr. Kelly Henning.
Thank you all for tuning in today. I'm Kelly Henning, and I lead the public health programs at Bloomberg Philanthropies. I'm here today to talk about the importance of data amidst the COVID-19 pandemic. For those of us who work at Bloomberg Philanthropies, we are no stranger to Mike's favorite saying, "In God we trust, everyone else bring data." But I think what the pandemic has underscored is the fact that there are still major gaps in how we collect the data and therefore how we can use it in real time to make effective decisions, like in this pandemic moment. The mapping of data to better understand rates across cities and states and even across the globe has been crucial in combating the epidemic. But we can still do more. And one lesson that we've learned over these past 2 years is that more purposeful collection of data about race, socioeconomic status, and other factors is very crucial. I'm so pleased today to have Beth Blower with me. She is the Associate Vice Provost at Johns Hopkins University, and she has spent her entire career improving people's lives by bringing data into the government decision-making process. Beth, I'm so pleased you could be with us today.
Thanks so much for having me.
So Beth, I'm going to dive right in with the first question.
Great.
Many people know about the Johns Hopkins COVID map. Tell me about the map and about the other various projects that beyond the map that you've been involved with to understand COVID better.
Yes, thank you. So in January of 2020, a small team of engineers at the Whiting School of Engineering here at Hopkins, led by Dr. Lauren Gardner, embarked on pulling together data around a nascent disease, something that they had done for other communicable diseases in communities before. And little did they know that they were really kind of unlocking one of the most important resources that has come to bear as we've navigated through this pandemic. We now have a whole set of resources built around the data that connect just the raw data to public health expertise here on campus, data visualization experts that have been really walking the public through the experience of COVID down to the very community levels that we know have been experiencing this pandemic in very acute ways.
Great. So Beth, COVID was really a watershed moment for public health data. What did you learn about how people can use real-time data to protect themselves, as well as to develop better policies?
One of the, I think, most important factors using and thinking about the COVID data that we've been working with, and that has been at the center of COVID response, has been the fact that it really sort of democratized the way that data, the role that data played in our lives. Everyone from public policy experts who are having to navigate those difficult decisions about whether their economies were open or schools were going to be open or virtual, down to individual people deciding whether they were going to engage in life-saving mitigation efforts like masking, getting a vaccination, going out and enjoying public life, or retracting and staying at home. These were all decisions that were guided by the very same data source. And it's something that I think is a very critical component to what we've learned around the role that public health data can play in protecting communities and public health.
So Beth, carrying on that idea about protecting communities,
There are a lot of urgent public health issues out there, everything from HIV to overdose deaths to chronic disease, and they lack comprehensive real-time data. Maybe not coincidentally, we've not seen as much attention paid to these issues. What can people committed to this area of work learn from the COVID moment?
Well, one of the things was that what we learned was a lot of the infrastructure that was used to collect this data, to aggregate it, and to share it with the public was built to support COVID tracking, which meant there haven't been long-term sustained investments in public health data infrastructure. So one, we have to invest in the tools and the platforms to be able to do this and the skills in government to do this in the long term. The other thing that we're learning right now is that states don't have a long-term commitment to approaching public health monitoring in this way. And we gotta really articulate a demand for it. There are lots of problems that we face as communities that can be solved with data and a firm understanding of the impacts they're having in our community. We don't want to let this, we don't want to have this genie go back into the bottle.
So Beth, I want to ask you a last question. What was it like for you personally to be in the center of this big data storm? And when you look back, what do you think you're going to remember the most?
No, I think, a lot of sleepless nights obviously were a big part of the work, especially early on. I never expected, 18, 20 months later that we would still be the standard bearer for the way that this data is functioning as it relates to COVID tracking and monitoring. And so I think it's really kind of redefined the role of universities and research institutions as a way to support how we actually engage in public health. But it also has called into question whether or not we have the right set of standards and the guiding principles from the places where we expected standard bearing to happen, like in our federal agencies and in the places where we look to really get a deeper understanding of the way that a global pandemic has impacts in our communities, but also those core public health challenges that we're all facing. And so I think it's a huge opportunity to take a moment and to really catalyze all of the investment that has been made, but also all the thinking that's gone in to how we can solve hard problems together as communities.
Great. Thank you so much, Beth, and thank you for being with us today.
Thank you.
COVID has shown us that an effective public health response starts with timely surveillance data. Our overdose crisis is no exception, but we still lack the national public health infrastructure to respond to overdose risk in real time.
When the pandemic hit, I was finishing a study with 29 Baltimore public schools testing a trauma-informed program called RAP Club to improve mental health for 8th graders. We knew additional data would be key for understanding teens' experiences during COVID.
Although the COVID-19 data dashboard has been a tremendous source of information, there still remains deep gaps in data quality and availability at final resolution, which has led many pressing environmental challenges to remain daunting. Questions such as what factors make some neighborhoods more vulnerable to the pandemic than others, particularly for communities of color and low-income population.
To address obesity, we can learn from the COVID data effort. We need better and more timely information, more comprehensive data, and integrated systems to understand the impact of food systems change and other factors on nutrition and equity.
First of all, we need more timely data, more complete data across the United States so we can make comparisons to understand what strategies are working and what are the root causes. Importantly, we need to understand where the guns are coming from and how they're making their way to use in crime. That data is key to solving these problems.
Again, now is a moment to explore how technology can help us rapidly integrate big data from multiple sources towards addressing a shared public health threat. What gets measured gets done. To protect us and improve health, we need innovations in infectious and chronic disease data now to build our defenses.
Dr. Lurie, thank you so much for joining me today.
It's great to see you again, Dr. Sharfstein.
So I'm going to make a prediction. We're going to start hearing a lot of people talking about how we need to be better prepared for the next pandemic, better tests, quicker vaccines, but we're not going to hear so many people talking about the core capabilities that make the difference for whether we can use interventions like testing and vaccines effectively.
Well, you're right. We do need better tests and we do need to have vaccines faster. But what we really need to do is be doing the day-to-day work of public health every day and to do it better so that when we need to pivot and use it in a crisis, we've got all those skills there.
So how do we do that? We have people listening who are doing all kinds of public health work, and they probably had to cut back on that work for the pandemic. And they may be looking ahead to just the immense challenges it could be in overdose or violence or food insecurity. And they're thinking like, well, anyone care about these issues, or is everyone just going to be talking about the next pandemic?
Well, I would maintain that the core skills to do all those things are the very same skills you need to manage a pandemic or any other emergency. So let's start with incident management or incident command, which we turn on whenever there's a crisis. But indeed, health departments that have used incident command systems for the last 10 or 20 years for outbreak investigation, for opioid overdoses, for food insecurity, for dealing with diabetes in their community, have found that the work goes better, faster, it's more efficient, and they get better outcomes.
So are you saying, for example, if you had like a spike in overdoses, the health department might say, we're switching to incident command, we're going to treat this like a emergency, and that's going to include how we communicate with the public, how we organize our services. And in a way, you're building the strength to respond to the next pandemic whenever it comes.
That's very well said. That's exactly what we need to do. And it's going to start with moving to shared situational awareness, as we call it, being sure everybody's seeing the same data. Most health departments now in a crisis put that stuff on a map. We ought to do that for everything. So you can see where it is, you see where you need to communicate with the public. You can figure out what languages the areas affected need communication in, just as an example. And you're right, we organize ourselves the way we organize ourselves for incident command, with a daily or a weekly incident action plan, with an incident commander, and with the elements of incident command that get you to that result.
So I hear you saying that doing that may actually make the response more efficient. I'm curious whether you think it also has an effect on people's understanding of public health, that to make that connection between the core capabilities of public health and the readiness for a crisis like a pandemic.
Well, one of the great things about using the incident command system, frankly, is that there's always a public information officer and there's communication with the public that doesn't happen lots of times in day-to-day public health, and really fine-tuning that skill so that the public health department is in the public health's consciousness every day or week, explaining what we know, what we don't know, what we're going to do about it, what the outcomes are. Those are the things that are going to make the difference in the eyes of the public. And if we see them making a difference for the things the public sees every day, like overdoses, like bad birth outcomes, like food insecurity, like a heat crisis, those are things that are going to make the difference in gaining the public's trust of a health department.
So in a way, what you're saying is public health shouldn't be afraid of the conversation about the next pandemic, but should be saying, hey, if you want to get ready for the next pandemic, let's take care of some of these problems like the emergencies and the crises they really are.
I would say we should celebrate the opportunity to be ready for the next pandemic. And we should let people know that they're going to get a dual return on investment for the resources they put into public health. And we need to show them the benefits of that investment day to day in everything that public health does. I think what we should be afraid of is the old mentality that public health is working best when it's not seen.
Public health has to be visible.
Every day.
Dr. Lurie, thank you so much for joining us at the Bloomberg American Health Summit.
It was a pleasure.
What a powerful conversation. Thank you, Josh and Nicole. All right, folks, it's time for another poll. Be sure to put your responses in the chat. Now we will hear from Ellen McKenzie, Dean of the Johns Hopkins Bloomberg School of Public Health.
Public health, visible. These words have meaning. Public health visible means that the spotlight is on us, and our opportunity to make a case for improving health and equity is now. It won't be easy. We can publish urgent data on health challenges, but will people pay attention? We can explain how major social policy changes will stabilize families and help children thrive, but will policymakers listen? We can and we will stand up for science, but will the public believe us? I don't have all the answers, nobody does, but these are the right questions. We must pursue excellence in the important work of public health, and then we must help people to recognize its value. Our work is urgent in every community in our country, which is why efforts like the Bloomberg American Health Initiative are so important. And now, with over 200 fellows and organizations from 41 states and Washington, D.C., the initiative aims to put public health tools and expertise on the front lines. Now, it's not easy being out in front these days, but I'm here to tell you, and others in public health, the Johns Hopkins Bloomberg School of Public Health has and will always have your back. It has been an incredible honor to see the magnificent work of so many faculty, staff, and students during the pandemic. And I know I speak for so many when I say there's no stopping now. I look forward to working with you over the days, months, and the years to come. And now it's my pleasure to hand it back over to Josh and Michelle.
We've heard from national advisors, public health officials, elected representatives at state and federal levels.
We've talked about the challenges facing public health and about opportunities to spring forward from the pandemic to make new progress for health and equity.
We've been inspired by the work of our Bloomberg Fellows, encouraged by insights of our faculty, and humbled by the commitment and persistence of public health leaders across this nation.
We were challenged by our keynote speaker not only to recognize racism, but also to confront it.
Josh?
Yes, Michelle?
I'm curious, what has been your favorite part so far? The university presidents, the governor, President Daniels?
You're not really going to make me choose, are you? I mean, what was your favorite part? And don't forget to consider Congresswoman Davids, Nicole Lurie, or that great discussion with the fellows about equity.
Point taken. It's hard to choose.
And it's going to get harder, because this afternoon's broadcast session at 1 p.m. Eastern is going to be fantastic.
Thanks to Mike Bloomberg and Bloomberg Philanthropies for the incredible support of the initiative and the terrific announcement today.
Thanks to Dean Ellen McKenzie for her leadership and commitment from the early days of the initiative.
Thanks to our fantastic fellows, partners, organizations, and faculty, and our dynamic and engaging host, Shane.
And thanks to you for tuning in. Now hold on to your virtual seats as we close our morning session with a performance from our very own Baltimore School for the Arts student, Sophie Snyder.
First time I heard your voice, moonlight burst into the room. I saw your eyes and I saw your smile, and the world opened wide, and the world was inside of me. And I catch my breath, and I laugh and blush, and I hear guitars. You are so good for me. I love you, I love you, I love you, I love you, I love you. And your childlike eyes and your distant smile, I'll never be this happy again. You and no one else. We've done this all before. We were angels once. Don't you remember? Joy and life inside our souls, and nobody knows, just you and me. It's our secret. This winter sky, how can anyone sleep? There was never such a night before. I feel like putting my arms around my knees and squeezing as tight as possible and flying and he's sitting in the drawing room, and I simply forgot